Welcome to Basic Instrument Passing. You have before you CST extraordinaire standing at the Mayo stand and the surgeon across from her. Typically, when you are passing instruments...
And my surgical team's safe. If they were to reach back, I want to make sure they're not going to stab themselves. So I'm going to pull it out just like I'm going to hand it to them. The blade, the sharp end, is pointed down or facing down. I am leaving enough room for them to grab, but I'm also protecting myself and them from the blade. And I place it in their hand like a pencil.
I'm taking it like a pencil, and that is how it is.
Yeah, pick up. See how I grabbed it by the tips? Putting it in their hand like a pencil. Exactly how they're gonna use it. My hand is not in her way, and then I'm up and away. So I'm going to take my needle driver, and the way that I always do this is how I remember, and this just helps me. I put my ring finger in the ring. So ring in the ring, my thumb here. I put my middle finger right there, and then my index finger to stabilize, and that will help you. I do the same thing with my suture scissors, my cut. So now I'm going right here. I'm going to grab it there, and then pull it out. And then, so see how it's on the tip? It's not too close to the tip that's gonna fall out, but you never wanna have it down here in the middle of the jaws of your needle driver. So you have it just like that. And then you pull it out, and to pass this to your surgeon, you wanna pass it exactly like they are going to use it. You pass it with the sharp end of the suture needle facing their sternum when they have it in their hand. So just like this. So it's facing them, and then they work with it just like that.
So on the suture above the knot, you're gonna wanna slide down until you feel that knot, turn the scissors at an angle, and then cut. And you see that will leave a little tail. So that always makes sure that you did not cut the knot. So that's kind of your safety net.
And hemostat. And when I pass a ringed instrument that is curved, I'm passing it where once they have it in their hand and it goes in the patient, the curve is going to be down. So see how I'm putting it in her palm like that? And the curves are now facing down. I'm putting it like that. If I see that she wants the hemostat in her left, all I'm doing right here, holding on to the box lock, I'm just flipping it, just like she's gonna use it. I don't have to switch hands to then rotate it. That takes too much. So then I have my hammer clip. It would be loaded. I would have checked for scissoring prior to loading it. That's all you have to do before you load it is just do this right here. Make sure the tips line up and they don't scissor. Then I would load it. It's loaded, and I'm passing it. This one you wanna be a little more delicate, because if you slap it into their hand, that clip will fall out and they will not be able to use it.
Let's do Gelpy.
Okay. Gelpy, you have to be very careful passing a Gelpy to your surgeon. You have to be careful for yourself and for them. So there's two different ways you can pass it. I like to pass it like this on top. So when I pass to them, they take it. I am up and away. You never pass it and drag down because it will cut you. So I'm passing it and doing it away. Or another way you can pass it is holding it like this. Like just on the side, on this side where I can get away from it. So I'm passing it to them and I'm just letting go.
And I am not watching your hand, so as soon as I feel the instrument in mine, I'm going into the incision.
As she is boving, I have the suction. I'm not gonna pull on the cord. I have the suction, so I am suctioning the bovie plume, the smoke, to keep it out of their vision. I'm not touching the tip of that, and I'm not getting in their line of view, but I'm suctioning the smoke. I just noticed my hemostat was there. And so always knowing what you're passing your surgeon. So you don't ever want to pass the incorrect instrument. She asked for a Pion. If I had passed the Coker that has teeth, or Ochsner, it would crush what she was meaning to clamp. So always know what you are passing your surgeon, and you just have to look at the tips and pass it to them. So you don't pass ones that look similar.
Should we do a blade on this side?
Yeah, blade. Okay, so now I'm grabbing my blade with my left hand. There would be no way for me to safely pass this with my right hand, with her on my right. So I grabbed it with my left, passing it across. I'm making sure they have it, and I'm up and away.
Then I'm gonna take my ring forcep, and I'm gonna clamp it right in the middle, containing both ends. I wanna make sure everything's contained at the bottom. Now this is a sponge stick, and it is ready to be used.